the veins in this particular model. Done?
Done.
Okay. Next, you have this mandible. This is the external surface of the mandible, body, and the ramus. Okay. Now it is uncovered. There were things that were covering the part of the cortical bone has been removed to show you the mandibular canal. And what runs in the mandibular canal is the inferior alveolar nerves and vessels. And inferior nerves and vessels, they give off these inferior dental branches to supply the roots of the molars and the premolars. Okay? When inferior nerve and the artery reaches the level of this mental foramen, it divides into two branches. One branch goes outside through the mental foramen, and this is the mental branch. And the other branch runs forward in the mandibular canal. This is called as the incisive branch. Incisive branch supplies the incisors and the canines. Okay, it supplies the incisors and the canine. Now, I hope you have understood the mandibular canal, what runs in the mandibular canal, and how it branches, and what structures it supplies. Okay, then you already know this is the ramus, condyle, cornoid process, mandibular notch, anterior border. On the angle of mandible, means like the place where the ramus joins the body, you have the attachment of the masseter muscle. This is which muscle? This is the masseter muscle. Okay. Now come on to the medial surface. On the medial surface, you have this ramus and you have this body. All right. And what's shown here is the lingual gingiva. All right. It's a lingual gingiva. Now, if you see the ramus on the medial surface, here you have the mandibular foramen. All right. Here you have the mandibular foramen, and this is the lingula. What goes inside the mandibular foramen is this inferior alveolar nerve. Okay. See, most of the inferior alveolar nerve is quite thick here, and it is quite thin here. So most of the inferior nerve, in fact, the inferior alveolar nerve goes inside the mandibular foramen, and with it, what other things goes is the inferior alveolar artery. Is that clear? Before entering the opening, the inferior alveolar nerves and the artery, it gives off this mylohyoid branch. All right. This mylohyoid branch of the inferior alveolar nerve and the inferior alveolar artery. See, there's a nerve and there's a artery. Both this nerve and artery, it runs in the mylohyoid groove. It runs in the mylohyoid groove.